Have you ever woken up with a sudden severe sore throat and swollen lymph nodes and thought to yourself, do I have strep throat? Unlike the common cold or flu, strep throat is a bacterial infection which needs immediate treatment. In this video, I'm going to cover the treatments, conditions, and symptoms of strep throat and how it's really important to seek medical assistance and treatment if you think you have it. Let's dive into the symptoms of strep throat. Strep throat has different symptoms than a viral infection like the cold or flu because it will cause the symptoms to be more severe. According to the CDC, symptoms of strep throat include
sore throat, painful swallowing, red, swollen tonsils, often with white patches or streaks of pus, swollen tender lymph nodes, fever usually above 101 degrees Fahrenheit, headache, and rash. Unlike viral infections, strep throat doesn't typically cause a runny nose or significant cough. The rapid onset of symptoms and the severity of the sore throat are key indicators of strep throat.
Strep throat is caused by Group A Streptococcus, a gram-positive bacterium. This pathogen is part of the normal flora in some people's throats but can cause infection when it enters the tissues of the throat and tonsils. The bacteria is transmitted via
respiratory droplets from coughing or sneezing, direct contact with an infected person's saliva or nasal discharge, and foraminate transmission, meaning the bacteria can also survive on surfaces and be transferred when people touch contaminated objects.
When the bacteria enters the throat, they stick to the cells in the lining of the throat using special proteins like M protein, which help them avoid being attacked by the immune system. The bacteria then multiply and produce toxins, such as streptolysis and erythrogenic toxins. These toxins can cause inflammation and damage the nearby tissues, leading to the painful symptoms of strep throat. They can also contribute to complications like scarlet fever. So how can you identify strep throat from the cold or flu? The key differences are:
first, rapid onset of symptoms. Strep throat usually comes on suddenly with severe pain, whereas colds tend to develop gradually. Localized symptoms, unlike the flu, which typically includes muscle aches, fatigue, and respiratory symptoms like cough, strep throat can affect the throat, tonsils, and lymph nodes. Absence of cough or runny nose. If you have a sore throat with no accompanying cough or nasal congestion, it's more likely to be strep throat than a viral infection like the common cold or flu. And lastly, white patches or pus on tonsils. The presence of white patches or streaks of pus is often indicative of strep throat, but it's not seen with viral infections. Additionally, fever, especially above 101 degrees Fahrenheit, and swollen lymph nodes are more characteristic of bacterial infections like strep throat and viral ones.
To summarize, strep throat is caused by Group A Streptococcus bacteria and presents with symptoms like severe sore throat, fever, and swollen lymph nodes. It's essential to see a doctor if you suspect you have lymph nodes, as untreated cases can lead to serious complications. With antibiotics, strep throat can be effectively treated, allowing you to recover quickly and avoid further issues. If you found this video helpful, like, comment, and subscribe for more in-depth health information, and stay tuned for more videos coming your way. Bye for now!